Thank you. Good afternoon, everyone. Welcome to Lunch and Learn with the Health Education Committee, Climate Change and Our Health. My name is Chantel Archer, and I am the chair of the Health Education Committee, which is a committee of the Connecticut Public Health Association. On behalf of the committee, we would like to thank everyone for participating in this Lunch and Learn. These Lunch and Learns are meant to inform, educate, and empower people about health issues, as well as increase the competency, skills, and performance of the public health workforce as they relate to the 10 essential public health services. Given that climate change is now back on the national agenda and 2020 ties as the hottest year on record, we thought it would be appropriate to host this particular Lunch and Learn. Before we continue, I would like to remind everyone to please keep yourselves muted during the presentation. We would also appreciate if you would enter your first and last names in the chat. This is especially important for individuals who are seeking CHES credits. And during the Q&A segment, please put any questions or comments in the chat box. Finally, this Lunch and Learn is being recorded and the recording will be available on our webpage. Now I'm going to introduce today's speaker. Dr. Laura Bozzi is the Director of Programs for the Yale Center on Climate Change and Health, where she leads the center's policy and public health practice work in Connecticut, teaches the clinic in climate justice law and public health, and is leading development of the new Yale Center on Climate Change and Health Policy Impact Unit. Previously, Dr. Bozzi led the Rhode Island Department of Health Climate Change Program. In that role, she worked to promote policy change, increase public awareness, and support community resilience building strategies that collectively help both mitigate climate change's negative health impacts and promote health equity. Laura was appointed as a member to the State of Rhode Island's Executive Climate Change Coordinating Council Advisory Board in the Agricultural Land Preservation Commission, and she also served as co-director of the New Leaders Council Rhode Island. Over her career, she has worked across the United States, from Oregon and West Virginia to Washington, D.C. and Rhode Island, in environmental protection, food systems, and fisheries. Laura holds a PhD in forestry and environmental studies from Yale University. Now I turn it over to you, Laura.
Great, thanks, Chantel. Thank you for the introduction, and thank you to you and your committee for inviting me to speak. I'm really happy to be here, and hope that this can be an informative and engaging presentation for everyone who's joining. Thank you for joining this lunchtime. So we'll talk about climate change and health in Connecticut. Next slide, please. First, I'll just take a brief minute to tell you about the Yale Center on Climate Change and Health. We are a university center based at the Yale School of Public Health, and we work through research, public health practice, policy, and education to address the health impacts of climate change and the health benefits of climate action. And we do that, our work is global, but we also have a real focus here in Connecticut, and I'll tell you more about some of our findings through that work in this presentation. We have a number of events that now, especially kind of the upside of COVID, a lot of them like this are virtual. So you can learn about them on our social media or by signing up on our newsletter. It's also a good place if you're interested in finding out kind of what's happening in this field, a good place to find information. And also the reports that I'll mention are on the website. Next slide, please. Okay, so just want to kind of give a real quick background, recognizing, and that's one of the reasons why it's important to do this presentation, that a lot of us didn't learn about climate change in our schooling, and it's not as well, it's not very well taught in the public health and medical schools, at least in the past. And so I'm going to give just a really fast primer to say, there's something called the greenhouse effect, which is that greenhouse gases, mostly carbon dioxide, also methane and other gases, create essentially a blanket around the Earth. And that is normally a good, for most of time, that has been a good thing. It makes our planet habitable by maintaining some of the Earth's warmth, or some of the sun's warmth, the sort of irradiation of heat inside of our atmosphere. The problem is that particularly by burning fossil fuels, coal, oil, and gas, we release carbon dioxide. There are other practices like agricultural practices that landfills that release methane, deforestation releases carbon dioxide. Those kinds of human practices have put too much of those greenhouse gases into the atmosphere. And so it's like too heavy of a blanket on the Earth, maintaining too much of the heat. So we've already experienced, as I'll talk about, we've already experienced increases in temperature and are projected to experience more. And that temperature then has a wide range of impacts, from warming oceans that cause changes in our weather systems, our storm systems, to melting of glaciers that have caused and will continue to cause sea level rise, and a number of other impacts. But that's kind of the general climate. That's climate science in a real quick nutshell. Okay, next slide. And then this is to prove the point that so this is tracking atmospheric carbon dioxide levels. This is from NASA in parts per million. And so it's showing it going back 800,000 years. And so it has oscillated, but it's never been this high. You can see that it's never been beyond that 1950 level. And now we are just on this straight up, kind of not even a curve, just a straight up line. Okay, next slide. So now we're going to really dig into Connecticut. That was the global perspective. So global climate change, this is a global problem. But, when we decided to write this report, we felt like it is a global problem. It's a kind of a long-term problem. And that's how it's been framed a lot, is that it's far away in the future, happening to non-humans, right? That's kind of how we were taught about it. Polar bears in the future. But the truth is that it's a public health issue here in Connecticut, and it's happening now. And we can do something about it, including as public health professionals. And so that was a lot of the drive for writing the report that I'm going to tell you about, called Climate Change and Health in Connecticut. We published it in 2020. And we did this by identifying 19 indicators of environmental and kind of weather conditions, and also health outcomes that reflected the kinds of issues that we saw in the scientific literature as related to climate change. And so we wanted to see, going back as far as we could in the data sets, do we see a trend here? Is there something that's showing kind of the signal of climate change? And then also, especially, what do we expect in the future for this? And to try to explain it in a way that could make it really sort of widely available to residents, advocates, policymakers, health professionals who might be able to make use of this information. Next slide. We used lots of different data. We didn't collect our own data, so this was all publicly available. We got things from the Connecticut Department of Public Health, a lot of things from the federal government, from the National Oceanic and Atmospheric Administration, from the Connecticut Department of Energy and Environmental Protection. So a variety of data sources that are generally all kind of already on a website, so that if you're curious to dig in yourself, you could go to the sources and look at it. We also tried to get the detail at a county level as much as we could, recognizing that you kind of want to know what's happening really close to home. Next slide, please. Okay, so very quickly, I'll tell you about some projected climate change physical impacts, and these are largely from a University of Connecticut report. So when we compare the kind of base period of the 1970 to 1990 toward about 2050 to mid-century, we can expect about a 5-degree increase in annual average temperature. We're already well on our way, as I'll explain. 8.5% increase in annual precipitation, but it's spotty, so that we have more rain, more heavy rainfall, largely in the winter and the spring, and then more drought in the summertime, drier summers. So extreme summer droughts occurring 3 times more often. Warm spell days, so that's kind of heat wave days, increased from less than 3 per year in the 1950s to 44 per year in 2050, and more than 120 per year by 2100. So these kinds of heat waves that we've been experiencing this summer, we can see that they're becoming more common, and they will increasingly become more common. About a 0.5 meter of sea level rise by 2050, but that's projected to get to, I could get up to a number of feet by 2100, depending on sort of number of factors. And Atlantic hurricanes are expected to become more intense with greater amounts of precipitation. Next slide, please. So as you know, I think as health professionals, something like climate change happens to everyone, but it doesn't happen equally across our population. It's the same thing with COVID, right? That those that are already more vulnerable, climate change is often called a risk amplifier. So those that already have pre-existing medical conditions, that are poor, that live in communities where there's been disinvestment in their infrastructure, those who are old or young, people of color who have experienced historic discrimination. These groups of populations are likely to be more vulnerable, more at risk to the impacts of climate change than others. And so when we're designing our policies or our public health interventions, we really need to understand who is vulnerable to it, and how do we make sure that they're incorporated and in the outcome, and also in developing those interventions. Next slide, please. Okay, so the report had 4 sections, and I'm going to pick a few of the indicators out of each of the sections. The first is on temperature. Next slide. Annual average temperature has increased in Connecticut in every county by over 3 degrees from 1895 to 2019. And that was a statistically significant increase. You can see it's just kind of a very clear, straight increase over time. So what does that mean for health? Heat-related illness, I'll talk about that more in a minute. There's also, you probably noticed this often on the heat alert days, there's also an ozone alert day. So those two coincide, making for kind of a double whammy of potential health impacts. The warmer temperatures are year round as well. So that also means warmer winters. Warmer winters can lead to suitable conditions for larger, more active tick and mosquito populations. So they're active over longer periods of time than we're used to. Their populations can grow larger. The range expands, and longer seasons for ragweed pollen and other kind of allergy and asthma triggers. Next slide, please. So digging into heat-related illness a bit, and by that encompasses heat stress up to and heat exhaustion, heat stroke. From 2007 to 2016, there were on average 422 emergency department visits, 45 hospitalizations for heat stress in Connecticut. This is definitely an underestimate. A lot of times it coincides with another condition, and it's not tracked. It's not kind of marked related to heat stress. And as I mentioned, there are populations that are more at risk than others because of physical vulnerability or a lack of behavioral or resources to adapt. And then I also want to point out that on the right-hand side, you can see what is a phenomenon called the heat island effect, urban heat island effect, which is that, and you kind of know it intuitively, cities are hotter than the area around them. And that's because they have more of the kind of man-made concrete and asphalt metal that absorbs heat and retains it. and also fewer green spaces or blue spaces that are cooling the area. They also have more machines, cars, and things that emit heat. So we know that cities are hotter than other areas, making urban residents more vulnerable to heat-related illness. Next slide. So what can we do about this? We have a whole brief about this that explains the issue in more detail and lays out a number of recommendations. So I'll just name a couple of them here. One is make homes cooler, more energy efficient, and powered by renewable energy. There are programs to help homeowners and homeowners, unfortunately it's just homeowners, to weatherize their homes to make them better insulated so that the cool air stays in, less of the hot air gets in, and it also stays warmer in the wintertime. There is hopefully there will be an expansion of the LIHEAP program, the utility assistance program, to allow for helping people pay for air conditioning in the summertime as well. Supporting urban tree planting and maintaining the existing tree cover in Connecticut cities is important to address the urban heat island effect. Policies to protect against heat-related illness at work sites, schools, and sports teams. There's good legislation about education for sports teams that passed in the General Assembly this past year. So that's important. Young youth, especially football players, the beginning of the season are vulnerable to heat-related illness. And municipalities can more fully develop and maintain their local heat response plans so that they get the word out to vulnerable populations in time before a heat wave, and have all the mechanisms set up to help people to access cooling centers, or if they can't have cooling centers, to access cooling options somewhere else. And then personal action, you can check on elderly neighbors. You can cool your neighborhood with tree plantings or cool roofs. Those are just a few examples. Okay, next slide, please. And I'm like blowing through, there's a lot to cover, so I'm kind of blowing through this and giving you a very broad experience with this. And I really encourage you to look at some of our reports if you'd like to dig in a little bit more. So next we'll talk about extreme events. Next slide, please. So first, in terms of weather disasters, this indicator, we looked at the federal disaster declarations in Connecticut, and we found that from 2010 to 2019, 9 federal disaster declarations for weather events were issued for Connecticut, compared to only 13 in the previous 56 years. And if you can see on that, you'll probably remember some of these: Irene and Sandy, the Halloween nor'easter, and that they're covering. This isn't just a coastal issue. They covered all of the counties. So by weather disasters, that's a lot of different kinds of disaster types. But if we're especially thinking about flooding and hurricanes, there are direct dangers to health, like from drowning. But a lot of the health impacts actually come in the days following. So it's a stressful, traumatic time that can affect people, especially with pre-existing conditions. People may need to evacuate and they don't bring their medication, or if the electricity goes out and they are on medical equipment. So it can be, those kinds of events can be life-threatening. There's also, especially in the longer term, mental impacts from the trauma of the event, and that can also happen to children. And again, this doesn't happen equally across the population. There's structural inequality, both in access to evacuation. If you don't have a car, you may have difficulty evacuating. If you don't speak the language and the emergency information is only provided in English, then you may not have the full information that you need to reach safety. So there are a lot of ways that these weather disasters affect a wide range of health conditions, and really intersect with these issues of inequality. Next slide, please. In this indicator, we looked at Superfund sites. So Superfund sites are managed under the federal government. There are sites that are identified as having toxic waste, that they're contaminated with hazardous waste. It's often old factories, or maybe an old gas station, or a landfill. And so in this study, it was a federal government study, they looked at which ones could be impacted by climate change. And so they found that of the 16 superfund in Connecticut, seven of them were vulnerable to climate change impacts, particularly flooding, but also hurricane storm surge and sea level rise for the one that's on the coast. And this matters because that kind of impact can release those hazardous materials into the air or the water or the soil, where then they can affect human or other animal health. Next slide, please. We looked at high tide flooding using data from two different tide gauges, one in New London and one in Bridgeport. So if you live along the coast, we often hear stories about areas like around Branford, where on a high tide, especially like a full moon high tide, roads can be flooded. So and then the water recedes when it goes back to low tide. So this is sort of flooding that happens with the tides. But as sea level increases, those high tide flooding events become more common, to the point where there are areas where you need to think about whether the existing infrastructure or homes can stay where they are. So in fact, we looked at the number of high tide flooding events at these two tide gauges, and we saw that there was a statistically significant increase in those events over time. And then we also found data showing the projections into the future of what would happen in the future. And it depends on the future scenario for sea level rise, but we're likely, I think the intermediate scenario that you see on the bottom is maybe more likely. And that's the case where by 2100, it could be high tide flooding every day, right? So that what they say is today's flood becomes tomorrow's high tide. And in its current state, high tide flooding is not a significant danger to public health, but it can cause issues like transmission of pathogens, like Vibrio bacteria if you walk through the tide waters, or contaminate coastal drinking water sources and agricultural fields. There are certain areas where those drinking water sources are close to the coast. Next slide, please. A few points on what to do. Again, I come back to, we know in public health, housing is a really important social determinant of health, and that's the case related to climate change too. So if we make our homes more climate resilient so that they can better withstand floods and storms, so that, if there's a disaster event, that someone can return to their home, that it's not in such bad shape after the storm that they're displaced, that's really important. The Federal Emergency Management Agency, I think, has something called the community rating system that municipalities can sign on to with a number of actions, and it reduces the rate for flood insurance for residents, which makes it more affordable to sign on, and it's required for people that are within a certain area. So it also helps them stay in their homes. Begin discussions on planned retreat for those areas where the flooding is happening so commonly that it's making living there or maintaining infrastructure very difficult. And supporting emergency planning and backup power at congregate settings and senior living facilities, especially during, if there was an example in Florida when during a hurricane of nursing home lost power, and the temperature was so high that they had a number of fatalities. So that's a circumstance where you have kind of the double impact of storm plus heat plus vulnerable elderly population that proved terribly fatal. So we want to be making sure that we're planning for those kinds of events. And then for personal action, make sure that you make a plan. It's that kind of classic emergency preparedness. Do that with your family. I didn't talk about it here, but we have an indicator on drought, and that's becoming more of an issue here in Connecticut. So look into how you can adopt water conservation measures within your home. Next slide, please. Okay, on to infectious diseases. Next slide. In this indicator, we use data from the Connecticut Agricultural Experiment Station, and we looked at mosquito abundance and found that from 2001 to 2019, of the 28 mosquito species found in Connecticut to carry viruses that cause human disease, 10 showed trends of increasing abundance and 3 showed trends of decreasing abundance. And that's important because abundance, that increasing abundance, is often a sign of the possibility of an outbreak. And you can see here that of those human diseases that those mosquitoes carried, some of them are quite well known to us now, unfortunately, like Triple E and West Nile virus. Next slide, please. On tick-borne illness, this was one of the first kind of declining trends that we found. So in fact, total and probable Lyme disease cases in Connecticut over approximately the last decade, 2008 to 2018, decreased in the state. That made we weren't able to track tick numbers. It may be that it's that people in Connecticut are good at protecting themselves from ticks. We've adapted our behavior. On the other hand, there are emerging concerns. The Lone Star tick is the most common tick species. Hold on, I'm gonna see if I get make sure I have this right. It's the most common human biting tick in the southeastern US, and it's expanding into the Northeast due to factors including warming temperatures and especially warming winters. And the Lone Star tick transmits a variety of illnesses, including one that you might have heard about a red meat allergy. So this is one example of emerging vector-borne or vectors that are expanding into our area that we need to track and make sure that we are educating the public about these emerging concerns. Next slide, please. This indicator is foodborne Vibrio infections. So this can come from eating contaminated raw or undercooked shellfish. And what's really notable about this is that the number of infections tracks very well onto the warming ocean temperatures, near surface water temperatures in Connecticut in the summertime. So this Vibrio becomes more common in warmer temperatures. And largely we don't have, there are different species of Vibrio, and largely in Connecticut, we don't see the ones that are the most threatening to our health. But this is still certainly a health concern, and one that we need to make sure to be tracking for those that are more dangerous. Next slide, please. What to do? We certainly need to continue our surveillance of vectors, mosquitoes, and ticks associated diseases to be tracking for these emerging concerns, and continuing public education on these. Developing vector-borne disease prevention and management guidelines at schools, outdoor recreation, and at homes. That's important for, say, outdoor ball fields, to make sure that they're properly managed to reduce the likelihood of finding those vectors there. And then personal action. I think in Connecticut, we largely know these things about tick prevention, wearing long pants and doing a tick check. And then with mosquitoes, keeping mosquitoes out with high quality housing, with tight screens on windows and doors, maybe adapting the times that you're outside to reduce the times of day when you see these most. Next slide, please. Okay, so this is our last indicator on air quality. Next slide, please. Again, you may know this. Connecticut unfortunately has a problem with ozone. We have some of the worst, particularly Fairfield County has some of the worst ozone air quality in the East, on the East Coast. And some of that is because of actions within our own state, but it's also that we're largely getting a lot of air pollution, both sort of ozone precursors and particulate matter from the West, and it blows over to us. On the other hand, it has been getting better. So you can see in this graph for all of the counties that the number of the ozone exceedance days, and particularly the ones that were at the worst levels, are decreasing over time. And so that's good news. But we certainly have further that we need to go to be protective of health. The American Lung Association gave, at least last year, gave every county an F for its ozone pollution. So that's not good news. We have a lot more to do. Next slide, please. And finally, aeroallergens. It's actually really interesting that at Waterbury Hospital, there's a monitoring station for air allergens for these four: mold, grass pollen, tree pollen, and weed pollen. It's the only monitoring station in the Northeast. Most of the other data that you get is modeled, but this is actually collected. And we looked at kind of trends over time. We didn't see a lot of trends, except that we saw that since 2007, the percent of measured days with high or very high outdoor mold concentrations increased. But still, we know that national indications of changes in pollen exposure are likely associated with climate change. And so more atmospheric carbon dioxide concentrations, warmer temperatures, encourage more growth of plants that produce pollen, the amount of pollen that they produce, the seasons that they are sort of emitting pollen, sort of their growth seasons, leading to more exposure or more pollen in the air that can affect us both in terms of allergies and asthma. Next slide, please. What can we do? Again, we have an issue brief that digs into this in particular. That issue brief, it's called the Air Quality Health Benefits of Climate Action. It makes the point that by taking action on climate change, by reducing our use of coal, oil, and gas, we're also reducing the emissions of these local air pollutants like ozone precursors and particulate matter. So that has an immediate and local health benefit. So as we work to switch to public transportation and to electric vehicles, as we work to switch to heat pumps rather than oil to heat our homes, as we switch from large kind of dirty fossil fuel power plants to wind and solar, then we're also doing really important work to address the air pollution that we have here in Connecticut, as well as addressing climate change. So that's what a lot of these relate to, is really pushing on our policy here in Connecticut to address climate change, to also achieve these health benefits. And then you can also take action on that personally. You can sign up for an energy audit for your house to find out where are the places where you're losing energy, and you could weatherize to make your home more energy efficient. You could opt in for renewable electricity, use active transportation like biking, walking, and public transit, electrify your house or your transportation with heat pumps and EVs. Okay, next slide. Okay, so I'll wrap up with the recommendations that we make in the report, and I'll highlight a couple of them. So first is swift action to reduce and eliminate carbon emissions. The clock is ticking for us. It is very clear this summer that climate change is happening, right? I mean, it's like hitting us across the head with the news of wildfires, with drought, with heat waves, with flooding. I mean, this is a signal that the pace is accelerating. And we know from the scientists that we need to act to reduce our emissions to zero by 2050 to avoid and beyond that track earlier to avoid the worst consequences of climate change. And we need to do that work here in Connecticut as well. In addition to that, or as a way to support that work, I'll emphasize here that number 5, build the capacity of health professionals and decision makers and other sectors to address climate change and health. I hope that this presentation is one way to help build that capacity, but I just want to really emphasize that public health professionals are among the most trusted in our country, and I think maybe COVID was a challenge, but public health professionals are very trusted, and so your ability to speak about the climate change impacts to health that maybe you observe in the population that you work with, or because of your knowledge of the science, and be able to make that kind of science and health-based justification for action on both mitigating climate change, reducing our greenhouse gases, and also on adapting to these impacts that we're already seeing. It's really important. And you can do that at all levels. You can do that with your friends and family, with your municipality, with your state representatives, with your federal representatives. You have a really important voice. And then the other is that I think as public health professionals, you also have this opportunity to work on how addressing climate change relates to other parts of your work in public health, on addressing these social determinants of health. So when you're working on maybe something about physical activity, thinking about how can that be part of also addressing climate change? How can it be done in a way that it's reducing our dependence on cars, or maybe that's done in a way that supports urban greening, so that people want to walk on their sidewalks more to get physical activity, but in a way that's cool, or maybe you're doing it so as part of an education program. If you're telling people to go outside, tell them also how to protect themselves and teach them about the dangers of extreme heat or vector-borne diseases. So I think that there are a lot of ways where I know that we're all pressed for time in our work, but thinking about how this might relate to your work and could be incorporated into it. So next slide, please. So with that, I'll wrap up my part to say, I encourage you to go to our website. You can see this report and the other issue briefs that I mentioned. They're on we have a Connecticut program page. You can also contact me at that email address. And then next slide. This is my final slide with also some instructions and requests from the organizers. So thanks so much, and I'm happy to answer questions now.
Thank you so much, Dr. Bozzi. That was a really wonderful presentation. So I'm hoping to turn this segment over to one of our core members, Taylor Williams, so she can facilitate our question and answer portion of the presentation.
Thank you so much, Chantel, and thank you again, Dr. Bozzi, for that amazing presentation. It was very helpful and insightful, and letting us know what we can do to contribute to this issue and solve it for future generations to come. So thank you again. And yeah, I'd like to jump into the question and answer portion. And if anyone has any questions, please feel free to type them in the chat or unmute yourself so we can kind of get it started. Right now, I don't see any questions, so I can give people a minute or two to kind of think about what they might want to ask. And yeah, please feel free.
I can read the question aloud. So Juan, nice to see you. He says, public health does not appear to receive as much attention with policymakers at the state level, the Governor's Council on Climate Change or the GC3. Health professionals such as CPHA should be mobilized to influence Connecticut climate change adaptations. We need more resources, levers, public awareness, and support. I definitely agree that there's a really important role for the Connecticut Public Health Association. I think the state is doing important work. I think that there's not a lot of capacity. There's no, as it was mentioned in my introduction, I led a climate change and health program at the Rhode Island Department of Health. It was funded by the CDC. And there are only maybe about 15 of those programs currently funded in the US. And so it allowed them to have someone like me, but they wouldn't have had the funding to do that otherwise. So it's also a question of, it's kind of, what can we do without the funding? How can we support each other to do things without the funding? And then also, like, let's make sure that Connecticut gets more support, especially at the federal level, to increase the capacity on this. Is there a formal One Health initiative currently in Connecticut? I don't know of anything, but it doesn't mean that it doesn't exist. So my understanding of One Health is that it's human, environmental, and animal health, and about the relationship between them. Is that fair, Courtney? I'm not sure. There's more work, like at Yale, we've been more and more involved in something called planetary health, and actually the nursing school at Yale has been doing a lot of work on this. And so that's even kind of bigger than One Health. It's kind of looking at how does the planet's health, including climate change, but also biodiversity and other issues, how does that affect human health, and what's the relationship between the two of them? So that kind of expands that concept even further. Yes, we should start one. Renee asks, based on this presentation, it seems like Connecticut will be impacted by climate change less or later than most other states. Is that true? If so, do we need to have a framework for thinking about regional or national or global impacts more than local impacts? Yeah, I hear you, Renee. I think that I think we're relatively lucky compared to some states in the West that are so impacted by wildfires and drought, and in the South with hurricanes, and the West has a lot of drought issues. But I guess for me, seeing the heat wave that hit the Northwest, that actually hit home for me, because I felt like, wow, like that could have just, like, maybe that could have been us too, right? It really, I think it kind of blindsided. That was my kind of perception of it, was that it really hit them out of nowhere. It was like so far from what had happened in the past. So in that way, I feel like we need to, this is our opportunity before we've been hit so hard, to get our ducks in a row and be well prepared. But there is, I think you make a really good point that there's also important work to do that we can be part of at the regional or national or global level, because it also is recognizing that impacts in the US will be bad, but we have more resources than a lot of other countries in the world. And there's a responsibility there as well. Yeah. Joyce asks, do you have experience responding to a common perspective by individuals who interpret the dire predictions of the impacts of climate change as so inevitable that they can't do anything meaningful to make a difference? So they use it as an excuse not to make a change. Yeah, it kind of flips over onto itself, right? There are some people who are in denial that it exists, and so they don't take action, and then some that are kind of fatalist. I think, well, so one thing you can say is, in that case, sometimes adaptation is a good place to start, of like, we're experiencing these impacts now, what can we do to adapt to them? But often people feel better once they're taking action. And so sometimes, I'd like kind of rather go down trying that sort of, I guess that's my own, that's my own reaction to it. But I think trying to find one way that feels productive, people feel better when there's something that feels productive. So recognizing something that feels productive. There are also what actions that you can do that help climate change, but they also really help something else. So I think that's one of the reasons that people really like urban tree planting, or other kinds of actions like that, where you really see a local benefit, local agriculture. You see a real local benefit, as well as that broader climate benefit. Maria asked how green buildings can help fight climate change. Is Connecticut working on it? Yeah, green buildings are huge. I think it's something that's not as much talked about, but they're a major source of our greenhouse gases, and of health issues as well. Housing. There is a Connecticut Green Building Council. They do great work, including on advocacy. So I encourage you to check them out. There have been some, what else can I say about that? There's work actually to try to really make sure that our affordable housing funding goes toward green building construction, which again, I think that has like so many health co-benefits to it. And so I hope that is supported. I think that's a really important policy. Jamie asked, are you aware of any local committee that we can get involved in? Gosh, I'm sure that there's lots. It depends on where you are in the state. I think that there are like town energy committees. Towns that are part of Sustainable CT. I think they might have some town level ways to be involved. And then there's also Climate Reality Project. I think that they have local chapters, and they do good training if you want to kind of learn more about how to be an advocate. And then there are great state organizations that are doing this kind of work, that ask for members, and can help engage you. Groups like Save the Sound and others. Great. Well, I think that's, Veronica asked, has Connecticut discussed any policies to make composting and related education accessible to everyone in efforts to reduce waste and reduce methane emissions? I don't know. That's a great question. It's not something that I've tracked, and so I'm not sure what the current policies are. Yeah, but I'll just say composting is it's also important because you may not know this, but we have trash incineration in Connecticut. So we burn our trash, and it's largely in environmental justice communities. There are laws that regulate the air pollution that comes from them, but they're still, I think they're a terrible idea and if we reduce our trash through things like composting, then we're reducing the amount of trash that we need to then dispose of. So it's one way to also address something that seems quite unrelated, right? But is actually quite related because of the way that we deal with our trash in Connecticut.
Do we have any more questions? I know we're getting close to the hour. So if we have any last minute questions. Oh, it looks like we have one.
A concern is that as much as the scientists can form modeling prediction with limited resources possible, we not know enough. For example, we do not see the heat dome phenomenon in the Northwest in BC 2021. Yeah, I mean, it's, I think the science has really progressed, but we're still working on it. And I think especially working on being able to have really localized predictions. Put up the website again. Let's see, I can put that in the chat. So that's for our main page. And then this is the one that has the Connecticut reports.
Any more questions? I think that might be it. So I think on that note, I would just like to say thank you to Dr. Bozzi for a really wonderful presentation, which prompted a lot of good questions and discussion. And thank you everyone for participating in this Lunch and Learn on climate change. Please send ideas for future Lunch and Learn topics to heckcpha@gmail.com. I'm going to put 2 links in the chat. One is for, just for the standard evaluation. The other link is for those who are interested in seeking CHES credits. And just a reminder that this presentation and recording will be made available on the HEC webpage. So thank you again, everyone. And I hope you have a great weekend.
Thank you, Laura.
Thanks, everybody. Take care.
Have a great day, everyone. Take care. Thank you.
I'm just looking for the link for the CHES credits.
I'm going to put them in right
Oh,
now.
perfect. Thank you. Mhm.
It should be in the chat now.
You got it.
We'll just stay on a few minutes just to make sure everyone has the links to the evaluation.
Awesome.